All right, hello everybody. Dr. Ruiz here at Options Rehab. This is Dr. Nick working on our patient here, Joe X, protect the innocent. We have a patient here, post-surgical. How many weeks, Nick?
We're about 4 weeks out from a total knee replacement.
Okay, so total knee, 4 weeks out. Patient's moving pretty well. Tell me a little bit about what's going on here.
So we're just progressing, working on the small muscles on a unique device or tool technique called the spine force we use here. It's a stabilization equipment where it oscillates and turns as the patient is just kind of going in different positions. Another modality we're treating the knee replacement or the affected site is with a technique called factor or instrument assisted deep tissue work. So especially after major surgery or an injury, there's a lot of scar tissue associated with it. So what the tool or the technique allows us to do is to get into the joint as soon as possible to start mobilizing the scar tissue and the adhesions and the knots. There really is minimal discomfort associated with it. As a matter of fact, it really feels pretty good. Usually the patients report afterwards.
All right, so I'm going to capture the machine here.
You can switch to number 2, Joe. So as we go through the different positions.
So what's the purpose of the machine? What does the machine do?
So basically it's an oscillating moving dynamic surface, which is more working the smaller muscles. So simulating, I guess, walking on grass, on sand, on gravel, different surfaces you're going to encounter in the real world. So it's a little bit more challenging balance. So again, we use this with many of our patients from back pain to ankle pain. It's a great and unique tool that we have at Options that many other, if not any other facility really has in the area.
Cool.
Really
Well, there you have it, folks. Knee rehab, total knee replacement rehab here at Options Rehab. Got a nice video there. 4 weeks out, and maybe we'll catch up with patient X here in a couple weeks and see how he's doing. Thank you. Give us a like, give us a share, and comments will be greatly appreciated.